Yesterday, the United Nations Office for the Coordination of Humanitarian Affairs launched its Global Humanitarian Overview for 2023, appealing for $51.5 billion to meet humanitarian needs around the world next year, an unprecedented amount to meet an unprecedented needs. A record 339 million people will require humanitarian aid in 2023, 1 in every 23 people on the planet. Humanitarian crises affect people in all aspects of their lives, including reducing their access to health care, often at the exact time when they need it most. Those fleeing conflict or drought, or living in poverty and facing hunger, are also those whose health is the most threatened. In humanitarian crisis, health interventions like immunization, disease surveillance, and the treatment of malnourished children can be the difference between life and death. Last Saturday marked 1 year since WHO announced a new variant of concern in the COVID-19 pandemic, the Omicron variant. Omicron has proved to be significantly more transmissible than its predecessor, Delta, and continues to cause significant mortality due to the intensity of transmission. The number of weekly deaths reported to WHO has declined slightly over the past 5 weeks, but more than 8,500 people lost their lives last week, which is not acceptable 3 years into the pandemic, when we have so many tools to prevent infections and save lives.
There are more than 500 subvariants of Omicron that are in circulation right now. Most of these are the BA.5 sublineage, but there are a number of other sublineages, and the dynamics of this virus are very different around the world. We need to be able to track this. We need to be able to assess this with our technical partners around the world so that we can look at how these variants behave in terms of transmission, in terms of immune escape, in terms of severity, and to make sure that our interventions work. And my last point is that the interventions do work. I'll mention vaccines again, but the other tools that we have at our disposal, distancing, improving ventilation, those will be beneficial no matter what variant is circulating. But our vaccines are holding up incredibly well against severe disease and death.
We're pleased to learn that the Chinese authorities are adjusting their current strategies. We hope this progresses and we see that coherent, calibrated strategy emerge that balances the control of the virus with the lives, the livelihoods and well-being and human rights of the people of China.
Earlier this week, WHO announced that we will begin using Mpox as a synonym for monkeypox. Both names will be used for 1 year while the name monkeypox is phased out. Meanwhile, the global Mpox outbreak continues to decline with 620 cases reported last week, more than 90% of less than the peak in August. Most cases are being reported from Latin America.
The people in Tigray are desperate. They've been years now without access to proper healthcare, without access to proper nutrition. And they need our help now, not next week, not next month. They need it now. And I still, personally and my team, do not see evidence of unfettered access to the people in need in Tigray. That needs to change, and that needs to change soon. We hope that some of this is just the beginning to wind up the aid system again, but I have to admit I remain cynical on that front.
The only solution to this conflict is through political dialogue that's happening now and through peaceful settlement. We encourage that, but civilians should be at the center. Even when there is conflict, even in the middle of war, food aid and medical supplies should be delivered, and it should not be even a condition and should not be attached with the political or military dialogue which is happening.